Good afternoon. Thank you all for joining us today for our presentation, The Elements of Lymphedema Management for Cancer Survivors. I'm Angie Patterson, the Vice President of the Georgia Center for Oncology Research and Education, and I'm a 19-year breast cancer survivor. Just a little bit about Georgia Core. We're a statewide nonprofit that connects providers, researchers, leaders, organizations, and advocates to advance cancer care through partnerships and innovation. Are you having trouble hearing? I have a note that someone's having trouble hearing. Katrina, can you hear okay?
Yes, I can hear.
Okay. I wonder if someone's having difficulty. I just wanted to make sure I wasn't just rambling on and people couldn't hear me. Georgia Core, as I said, is a statewide nonprofit organization that connects providers, researchers, leaders, organizations, and advocates to advance cancer care through partnerships and innovation. We focus on statewide programs of cancer prevention, screening, clinical trials, navigation, and survivorship. A few years ago, Georgia Core conducted a statewide survivor needs assessment survey to understand the physical, emotional, practical, and spiritual unmet needs of cancer survivors. We had more than 800 survivors complete the survey, and 20% of those survivors needed help managing their lymphedema. As you can see the slide, we'd like for you to introduce yourself in the chat so that we know who all is on here. And at this time, I would like to introduce Dr. Crystal Champion, our speaker today. As you can see, Dr. Champion wears many, many hats. She is a doctor of physical therapy, a breast cancer survivor. She's the owner of Eminence Physical Therapy, LLC, and the founder of Champions Can Foundation for Cancer Awareness. She is a survivor who has become an advocate. And we are very proud that Dr. Champion is a member of the Georgia Cancer Survivor Advocacy Council that we established this year. So at this time, I would like to hand it over to Dr. Champion. Thank you.
Thank you so much, Angie, and to Georgia Core for the opportunity. And through this webinar, we're going to learn about the types and stages of lymphedema. We're going to understand the treatment for lymphedema, precautions for those with or at risk for lymphedema development, and also we'll learn the importance of early diagnosis and intervention for lymphedema. So as Angie said during my introduction, I am a breast cancer survivor, so I wanted to briefly share with you a little bit about my journey. So I had a baseline screening mammography May 2018 at the age of 37. And that was completely normal. And then I went for a routine screening mammography November 5th, 2019 at age of 38. At that time, I was called back for a diagnostic mammogram because there was a change seen in the left breast. And subsequently, I underwent a biopsy of the left breast on December 23rd of last year. And ultimately, that led to a diagnosis on December 31st, 2019 of ductal carcinoma in situ of the left breast, which is stage 0. And it was 99% estrogen positive, progesterone negative. So I underwent a lumpectomy with a sentinel lymph node biopsy, having 4 lymph nodes removed from my left side. And I also underwent a bilateral oncoplastic breast reduction on February 18th, 2020. And with the type of surgery that I had, it puts me at risk for lymphedema. I also developed axillary cording in the left arm, which was very painful. And currently I am on tamoxifen. I did not require chemotherapy or radiation. I had genetic testing. I was negative for the BRCA1, BRCA2 genetic mutations, but I do have a paternal family history of breast cancer. So this was me getting my mammogram last year, on November 5th, and the image of the breast is actually what my breast looked like on imaging. There are like little white specks of calcifications. You really can't see it from this photo, but I was smiling in this picture, not knowing that I was getting ready to enter a journey of my own with breast cancer. This is surgery day. You see the lymphedema alert bracelet on my left arm. And then this is the recovery phase. This was post-operative. There was a lot of pain, a lot of incisions. I had some issues with wound healing. And the little doggies, it's my sister's dog. He was providing me some comfort for my recovery. And then now I am a breast cancer survivor. And it means so much to me to be able to present to you on lymphedema from not only the professional standpoint of a medical professional, but also as a patient and a breast cancer survivor. So we'll start with a few lymphedema statistics. Up to 10 million Americans and hundreds of millions worldwide suffer from lymphedema and lymphatic diseases. All cancer treatment survivors are susceptible to developing lymphedema, especially if radiation was received or there was any surgery involving removal of the lymph nodes. Breast cancer-related lymphedema is the #1 cause of lymphedema in the United States. And 100% of people treated for head and neck cancer will develop lymphedema. Okay, so we're going to talk a little bit about the lymphatic system. So the lymphatic system is part of your immune system, and I like to call it the garbage disposal system of the body. So anything that your blood cannot circulate, your lymphatic system picks that up and it circulates through the body. So any toxins that are in the body are filtered out through the lymphatic system. It circulates white blood cells to help fight infections. And it also carries lymph fluid back to the bloodstream. So pretty much everywhere that you have blood vessels in the body, you have lymphatic vessels that run alongside those vessels. So you have lymph fluid that circulates through lymphatic system. And the lymph fluid is made of proteins and water, cells and particles, and fatty acids. And you may see a little red line at the bottom that says diuretics are not a long-term solution. Because lymph fluid has proteins in them, proteins are attracted to water. So a lot of times doctors will prescribe diuretics to treat lymphedema. However, diuretics will remove the water portion of the lymphatic fluid, but it will leave the proteins behind. And if the proteins like water, they will suck that water right back into the tissues. So it's kind of a cycle that goes, reduction of swelling, return of swelling, because the diuretics do not move the proteins that are in the lymphatic fluid. And we'll go into that a little bit more later. Anatomy overview, I know this looks like a lot, but the lymphatic system is very intricate. So it's made up of capillaries, collectors that form lymph fluid, collector vessels that transport lymph fluid. You have your lymph nodes. You have major lymphatic vessels that transport fluid deep into the body's systems. And you have lymphatic ducts that also help in circulation of the lymph fluid. Lymph drainage, again, this is just a picture of what everything looks like. Everything is very small, intricate. And I want to point out that the lymph vessels are right underneath the fatty layer of your skin. So they're not as deep in the body as you think. So again, those lymph vessels, this is just a visual of kind of how the system is networked together. And again, this picture just kind of shows how everything is right underneath the skin. And then lymphatic territories. So the way the lymph vessels are arranged in the body, it's called lymphatic territories. And the lymphatic territories are responsible for draining certain parts of the body. Lymph nodes, most people have 600 to 700 lymph nodes throughout the body. And most of them are arranged what we call regional lymph nodes. So you have them in your neck, your armpit, and your groin area. However, lymph nodes are scattered throughout the body, but these are what we call regional lymph nodes. So the functions of the lymph nodes is that, again, they help to filter harmful bacteria and toxins and dead cell particles out of the body. They regulate the amount of protein that circulates in the lymph fluid. And again, they help to circulate some of the white blood cells that help to fight infection when you're sick. This is just a picture of the lymphatic trunks and ducts. And again, these are some of the main drainage areas for the lymph fluid as it travels through the body and kind of circulates back up towards the heart. So the flow of the lymph fluid starts kind of towards the groin area, comes up through the center of the body underneath your diaphragm, which is the muscle that causes you to take a deep breath, and then can go to the left side of the heart. So what is lymphedema? I always say lymphedema is a fancy word for swelling that's been there for a long time, but basically it's an abnormal accumulation of fluid or protein-rich fluid in the tissues that is caused by an impairment of the lymphatic system. Symptoms of lymphedema. So there may be swelling of the entire arm or leg. I have actually seen cases of lymphedema in the arm where the hand was swollen and then gradually progressed up the arm. The fingers and toes can be swollen, and there can also be swelling in the genitals, in the abdomen, and in the trunk area. Most people will complain of a feeling of heaviness or tightness in the affected extremity. There can be discomfort or aching, although I've also had patients who have said that they have no pain with their lymphedema. There can be restricted range of motion in the affected limb with lymphedema, and there can also be recurring infections, and cellulitis is a big one. It's a superficial skin infection, and people that have lymphedema are more at risk for getting these skin infections just because the swelling stretches out the skin. The skin is stretched, there's openings that can allow bacteria in, and that can cause infection. There's also hardening and thickening of the skin called fibrosis. And fibrosis comes from that protein in the lymphatic fluid. So if that protein is left sitting in the tissues, it lays down scar tissues and it can change the texture of the skin and make it thick and hard. And once people develop that fibrosis, lymphedema can be harder to treat. It's still treatable, but it makes it a little more difficult to get that fluid to move the way it's supposed to. And lymphedema usually affects one limb, but you can have multiple limb involvement depending on the cause. And, if someone is having any of the symptoms that I just described, definitely check with your doctor and get a referral for lymphedema treatment because early intervention for this is very important. There's different types of lymphedema. There's primary lymphedema in which someone is born with an impairment of their lymphatic system. And you usually see this onset early in life. Sometimes you'll see people have primary lymphedema at birth. Sometimes it'll onset during puberty years, or sometimes it'll onset in adulthood, like at age 35 or greater. And then we have secondary lymphedema, which accounts for 90% of all lymphedema cases. And again, breast cancer-related lymphedema is the most common in the US. Secondary lymphedema is due to something that causes the lymphatic system not to function the way that it should. So for cancer patients, surgery, lymph node removal, having radiation. Radiation can cause damage to the lymphatic system because it causes scar tissue. And so that further limits the fluid being able to move through the body the way that it should. Trauma, so if someone is in a car accident and they have a fracture, that can interrupt the lymphatic system. An infection, malignancies or cancerous tumors that could press on the lymphatic vessels. And there's also something called chronic venous insufficiency, and immobility can also lead to lymphedema. So, being that this is tailored for cancer survivors, the most common types of secondary lymphedema is definitely due to the surgery, radiation, and to the cancer itself. Diagnostic testing for lymphedema. So I get a lot of people that ask, what special testing that can be done to diagnose lymphedema? And there's something called a lymphoscintigraphy. No, that's a mouthful. So a lymphoscintigraphy is a test where this radioactive dye is injected into the skin that ultimately is taken up by the lymphatic system. And it kind of gives a scan of the lymph system and the vessels to see where there's an abnormality. So once that dye is injected, it stays in the body for a certain amount of time and the patient undergoes scans. And wherever that dye is left, where you can see it mostly in the scans, indicates the area of lymphatic impairment. There's also Venous ultrasounds. Again, lymphedema can be caused by vascular issues. So a lot of you that have gone to vascular surgeons, a lot of times they'll do venous ultrasounds to check for any impaired function of the veins, because impaired function of the veins can also lead to a backup of fluid in the lymphatic system and can ultimately lead to lymphedema as well. So there are 4 stages of lymphedema. There's a stage 0, 1, 2, and 3, and I will go through these in more detail. So stage 0 lymphedema is called the subclinical or at-risk stage, and this actually applies to me. So anybody that has had lymph nodes removed, whether it's from your armpit or your groin area, you are automatically at a stage 0 risk for lymphedema. So that does not necessarily mean that you will develop lymphedema. It just means that you have a lifetime risk of potentially getting it at some point. So at this stage, there is no swelling. You know, we know there's an interruption in the lymphatic system. There's no tissue changes, but again, this is where education and getting patients to a lymphatic specialist is very important so that you know what to look for. Stage 1 lymphedema is called the reversible stage. This is normally where you see some swelling of the leg or the arm or the breast or the chest wall. The tissues are usually soft when you press on them. There's usually not any skin changes or skin hardening. And a lot of times just elevating the arm or the leg can help to reduce swelling. So I know at the top picture, that hand and arm looks really, really, really swollen. But the stages of lymphedema do not correlate with the size of the leg or the arm necessarily. We grade it by the way the tissue texture is. So even though this is a lot of swelling, this person had a pretty good reduction in the skin. It's nice and soft and pliable. So that constitutes a stage 1. And usually I see most patients with lymphedema stage 1 or stage 2. And next we'll talk about stage 2. This is where you start to see skin changes. So usually at this point, lymphedema has been present in the arm or leg for a while. And so again, you start to see that fibrosis from that protein that's sitting in the tissues. You get the hardening, you know, even though the limb may be swollen, you press on it, it's very difficult to make an indentation with your fingertips. So that is another sign that's indicative of fibrosis. And there's usually frequent infections. I know earlier I talked about a skin infection called cellulitis. So again, the pictures just show what a stage 2 lymphedema would look like in an arm, and then also what that would look like in a leg. And so, you know, even though they look significantly swollen, their skin actually still looks really good. There's no open wounds, but given like the little shelf area on this swollen leg, that is probably more likely fibrotic tissue that has overdeveloped. Lastly, there's stage 3, and this is considered lymphostatic elephantiasis, or some people will say elephant legs or elephant arms. And I go over this stage with a disclaimer because I usually tell my patients, you know, if you Google lymphedema, you're probably going to see pictures that look like this. They usually show you the worst case scenario. But usually stage 3 lymphedema, it's usually someone who has gone years and years and years without treatment for lymphedema. So I rarely see patients in this stage. As I said, usually it's stage 1 or stage 2. And most frequently, lately, I've been seeing a lot of people that have breast cancer that have just had surgery who are in that stage 0 or at-risk category. So stage 3 is not a good thing. However, if lymphedema is not treated, there are some people who can progress from a stage 1 to a stage 2, or from a stage 2 to a stage 3 if there is no treatment. So it can definitely progress through those stages. So unfortunately for lymphedema, there is no cure. However, this is a condition that is very, very treatable. Even though it can progress through the different stages, the progression is usually slow. And as I said before, for those of us who are in stage 0 or who is at stage 0 risk, we do have a lifetime risk of developing lymphedema. And later on, I'll talk about just some things we can do to reduce our risk of developing lymphedema. So lymphedema can form in other areas. Cancer patients can also get lymphedema into the breast, into the trunk, the armpit area, and in the genital area. So the picture that you see in front of you is a woman that has had breast cancer. And from the tissue changes and the discoloration, it looks as if she has had lymph node dissection from this scar here, as well as radiation. So she's got lymphedema into her breast, into her trunk area here from her breast cancer treatment. For head and neck cancer patients, a lot of times they will develop facial lymphedema or lymphedema in the neck. I've even seen it around the eyes and the tongue, just depending on the type of surgery and how much radiation the patient has had. And as I said before, pretty much 100% of all patients that have head and neck cancer treatment will develop lymphedema at some point. So factors that increase your risk for developing lymphedema is the number of lymph nodes removed during surgery. So me, for example, I had 4 removed. So I'm pretty low risk, and I did not have radiation. But some people have complete, lymph node dissections. They may have 12 lymph nodes removed or 20 lymph nodes removed. So the more lymph nodes you have taken out, the higher your risk of developing lymphedema. And as I said before, radiation to the area also damages the lymph vessels and causes scar tissue. And so that can increase the risk. And then actually obesity can increase your risk of developing lymphedema because the lymph vessels are right underneath the fatty layer of the skin. So the more body fat that you have pressing on those lymph vessels, it can actually impede the flow of the lymph fluid. And there are some studies that say that there's a genetic component to people being predisposed to developing lymphedema, but I haven't seen a whole lot about it. That is a subject that is actually still being studied. So now we're going to go over some lymphedema treatment. So we want to treat it because we want to maintain the integrity of the skin. We don't want that skin to break down and for you to start getting open wounds. We don't want you to get those skin infections and that cellulitis that I talked about. And cellulitis is actually a very serious infection. Even though it's just superficial on the skin, it can go bad very quickly. So, if you're noticing any redness on your swollen limb and it's spreading like within hours or within a day, and there's pain, there's a lot of heat to it, you want to go ahead and get to the doctor as soon as possible and get on an antibiotic, because if that cellulitis is not treated, that infection can actually spread to your bloodstream and it can cause septic shock. And I'll tell you, septic shock can lead to a stay in the intensive care unit. So you definitely don't want that. So it's so important, as soon as you notice something that doesn't look right, it doesn't feel right, make sure you get to the doctor. And also we want to treat lymphedema so that we maintain quality of life. A lot of times when you have a swollen, painful limb, it's difficult to raise your arm to bathe yourself or to dress yourself, or it's difficult to walk or stand for prolonged periods. So we want to treat lymphedema and get rid of that swelling so you can continue to do the things that you need to do effectively. So the gold standard for lymphedema treatment is called complete decongestive therapy, or CDT. And that has 4 components, which include manual lymphatic drainage, or MLD. There's compression bandaging, exercise, and skin and nail care. Complete decongestive therapy is performed by a physical therapist, such as myself, or it can also be an occupational therapist by trade who is also certified in lymphedema treatment. And I say this to caution you, not everybody who says they know how to treat lymphedema knows how to treat lymphedema. So when you're looking for a lymphatic specialist, make sure they have the initial CLT or the credential CLT, because as I showed you before with the anatomy, a lymphedema therapist has to have a really good understanding of the lymphatic system and knows how that fluid moves through the body so that we don't cause any damage to another part of the body. So please make sure, if you need lymphedema therapy or if your doctor refers you to a lymphedema therapist, make sure they have those initial CLT. And that just means they've had extensive training in the lymphatic system and how to treat lymphedema. And I also want to say that it is safe to undergo lymphedema treatment while receiving cancer treatment. I have several patients right now who are either still in chemo or they just finished radiation or about to start radiation. If they're having issues with swelling at that time, it is perfectly okay to begin lymphedema treatment because you're also under the care of a physician at that time, and you have a therapist and your doctors both monitoring what's going on with you in terms of lymphedema development. So manual lymphatic drainage is completely different from a deep tissue massage. It's very gentle, and because the lymph vessels are right underneath the fatty layer of the skin, the amount of pressure for a manual lymphatic drainage massage only requires enough pressure to stretch your skin. It's very gentle. I have people tell me all the time, well, Dr. Champion, I feel like you're barely touching me, so how does this even work? It's actually really amazing. So the goal of manual lymphatic drainage is to move or help that lymphatic fluid to move out of the swollen area and back into circulation in the body the way that it should. I usually like to use the analogy, just say, for example, if your leg is swollen from lymphedema, I like to say your downtown connector is backed up. So with the manual lymphatic drainage, we're going to use 285 to get around it. So those of you who are familiar with Atlanta traffic, you can appreciate that analogy. This next picture is a picture of lymphatic watersheds. And again, this just shows different drainage territories of the body, and different lymph vessels in the body are responsible for draining certain areas. Some drainage pathways that are taken by lymphedema therapists to move the fluid around. So if you see the X in the armpit on this picture, this means some lymph nodes was taken out of that area. So the path of drainage that the lymph therapist would use would be to move that fluid to the healthy lymph nodes in the armpit on the other side, and then down the side of the body to the lymph nodes in the groin or the inguinal area. So again, we want to take the fluid from the backed up area and move it to the healthier areas in the body to help get rid of that traffic jam, I like to say. And again, these are just pictures of different pathways that we use to move the fluid on the front of the body, the back of the body, the side of the body. And the way those vessels are connected, there are no territories that drain that lymph fluid diagonally. So that's why you don't see, a diagonal arrow here. You see them all kind of going straight across or down. So that's the path that the lymph system takes through the body. And there's different fancy names that we use for those. But again, I just say, let's reroute that fluid. Compression bandaging is another component of lymphedema treatment. So you see here, there's an arm that's bandaged and the fingers. And this is usually a treatment for women that have lymphedema from breast cancer. I've even had to bandage arms from people that have had melanoma or cancer in the arm or the back of the shoulder, and they've had to have lymph nodes removed. And then the leg bandaging is what can happen if someone has, for example, cervical cancer or prostate cancer, and you have radiation that can cause swelling down into the leg. And so the toes and then the entire leg up to the thigh is bandaged. And it looks like a cast. It's a pretty intense system of wrapping. And the bandages that are used for lymphedema treatment are called short stretch bandages, meaning they're specifically designed to help work with the muscles to move lymph fluid out of the swollen area. And a lot of people say, oh, they just look like ACE bandages. I can just go to the drugstore and buy ACE bandages and wrap my arm, right? And I go, no. ACE bandages are completely different. They have a higher stretch to them. And ACE bandages can actually cause what I call a tourniquet effect, or it can cut off your circulation if they're applied the wrong way. They're not designed to move fluid the way that the short stretch bandages are. So don't go and buy ACE bandages and wrap your arms and legs, please. So the effects of compression therapy, number one, once you've had manual lymphatic drainage, the compression bandages are applied to help keep that fluid out of the area. And for those that have that hardened fibrotic tissue, it helps to break down that hardened tissue, and it helps to soften it. And it also helps to move the proteins. So the lymph drainage massage moves the proteins in the lymph fluid, and the bandages also help to move the proteins in the lymph fluid, which makes it more effective in the reduction of swelling. Exercise is another important component of lymphedema treatment. And when I say exercise, I'm not talking about, powerlifting or running or anything that's really difficult to do. But, if someone is in bandages or compression garments, doing very gentle exercise further helps to pump lymph fluid out of the swollen area. So, if someone has compression garment on the arm or compression bandages on the arm, just doing elbow bends, raising the arm above the head, opening and closing the fingers, those are very effective exercises to help move fluid. And then for the legs, if you want to ride a stationary bicycle, if you want to go walking for 10, 15 minutes, standing at your kitchen sink, marching in place, these are all very simple things that you can do to further help pump that lymph fluid out of the swollen area. Skin and nail care is a very important part of lymphedema. This is the fourth component of treatment. So again, we stress the skin and nail care because we don't want to get those cellulitis infections in the extremity. So, just making sure you keep your skin clean, try not to use heavily scented soaps and perfumes and things like that that can cause skin irritation, avoid burns. Be careful shaving yourself. I know a lot of times, with cancer treatment and having surgery, a lot of times your nerves are interrupted and you lose sensation. So, to try and shave yourself with a regular razor, you may not feel if you have a nick or cut. So it's usually recommended that you use an electric razor just for safety. If you're playing with your pets or if you're outside doing yard work and something scratches you or you get a bug bite, if your dog jumps on you and scratches your arm or your leg, make sure you watch those areas for any development of infection. I'm not saying you just have to be on pins and needles with every activity that you do, but just notice, if something happens, pay attention to that area. So if there's an infection that's starting, you know what to look for and you know how to take care of it effectively. And then try to avoid injections and blood draws to be taken from a limb that's at risk for lymphedema. And there's been a lot of controversy about that. And I'll actually talk a little bit more about this later in the presentation. But again, anytime you're getting needle sticks and things like that in a limb that already is at risk for lymphedema, you have the potential to introduce infection in that area, and that can trigger the onset of lymphedema. So there's two phases of treatment. Phase one is called the intensive phase or the decongestive phase. So this is where you're receiving the manual lymphatic drainage. The compression bandaging is done if needed. The therapy is very intense. Ideally, we like to see the patients 3 to 5 times per week. In a perfect world, that would be great. But, as therapists, we do take into consideration that some people have astronomical co-pays and deductibles to meet when, having therapy, or you may live far away in a remote area and you have to drive a long distance to get to a lymphedema therapist. So I have effectively treated people twice a week with lymphedema therapy. And, if someone is seen 3 to 5 times a week, the intensive phase can last 2 to 4 weeks. But, if it's for financial reasons or logistical reasons and transportation and location, if someone is seen twice a week, then it stretches that phase out to, it could be 6 weeks or more, just depending on the severity of lymphedema. So your therapist will take measurements of your swollen area, And once your measurements stop to decrease, that's how we know that you're at a plateau, meaning we've shrank you as much as we possibly can. And it's now time to move to the next phase of lymphedema treatment, which is called the maintenance phase. And so the goal of this is all of the reduction in swelling that you've received in phase 1, we want to maintain that in phase 2. So that means, once you come out of bandages, you will go into compression garments that are going to help you maintain, that you'll need to wear every day. We teach you how to do the manual lymphatic drainage if needed. So if you feel like, my arm or leg is starting to swell a little bit more, but if you're at home, we can teach you those techniques to manage the swelling on your own. Continue simple exercises and continue to take care of your skin. And, this is a lifelong process. Once you have lymphedema, this is something that always has to be managed. So I always say my job as a physical therapist is done if I can get somebody successfully to phase 2 and they can maintain that reduction in swelling for quite some time. Now, I will say that sometimes, especially with Georgia heat and humidity, some people will get flare-ups in their swelling in the summertime. So I'm usually flooded with patients around that time. So just know that, fluctuations can happen. But as a general rule, most people should be able to kind of, manage their swelling and keep things under control relatively easily at home. So some contraindications or things to look out for lymphedema treatment. I don't recommend that you undergo lymphedema treatment if you have acute CHF, which is congestive heart failure, because, with lymphedema, we're already trying to move fluid and reroute it through the body, and it does go back towards the heart. So in congestive heart failure, the heart does not function the way that it should. So we cannot circulate that blood and fluid the way that it should. So, if you're having an acute congestive heart failure exacerbation, we don't do CDT treatment for that. Most people are usually in the hospital or at the doctor's offices at this point. Any acute skin infections or other types of infections, because like I said, the lymphatic system is responsible for fighting infection. If we're doing manual lymphatic drainage and you have an infection, that manual lymphatic drainage is going to spread that infection much more quickly through your body. Also, if you have an infection and we're doing compression garments or compression bandaging on an infected area, it will make that area really, really, really angry and make it worse. Renal failure or kidney failure. Your kidneys have to work extra hard if that, extra lymph fluid is moving through the body. So if you're already in kidney failure, we really don't recommend complete decongestive therapy for that. And, at that point, if you're on dialysis and things like that, we don't recommend it unless you've got a really, really special clearance from your doctor for that. And also an acute DVT or a blood clot. We don't want to compress an area that has a blood clot that has not been evaluated, because it can dislodge that blood clot, which can travel to other areas of the body and can cause a pulmonary embolism or a stroke. And those are definitely emergency situations. And for people that have very, very poor circulation in their legs or in their arteries, we usually try to avoid compression with that as to not compromise the circulatory system. So, I say if you have lymphedema and you've gone through treatment and then all of a sudden you get a new onset of swelling, we want to make sure we rule out an infection and a blood clot. And, for us cancer survivors, we also need to rule out that we don't have a recurrence of cancer. So, if you see something again that does not feel right, look right, please get to your doctor so we can determine the cause of what is causing the swelling. And if all of those things check out okay, they'll probably send you back to a lymphedema therapist and you'll just undergo another course of treatment for lymphedema. So for arm and hand swelling, these are examples of upper extremity compression, or what I call daytime garments. So you have arm sleeves and gloves, a gauntlet, which is kind of a half glove. You have velcro compression wraps on the arm. And these are to be used once someone has moved to the maintenance phase of lymphedema treatment. So once that arm has reduced in size, we want to wear compression garments to make sure we keep that swelling out. This is just another example of arm compression. And there's a lot of different products and brands on the market. I mean, they make these sleeves fancy now. They look like tattoos, or they have what I call the bling on them, all sorts of nice colors. So they've really come a long way on the compression garment designs. And for women with breast cancer, there are compression bras. There's compression camisoles. These little pads that you see that have the lines in them, those are called swell pads. So if you have swelling in the breast or in the chest wall or around the armpit area, a compression bra with a swell pad will help to manage lymphedema in those areas. And I actually wore a compression bra and a swell pad after my surgery because I had a lot of postoperative swelling in the left breast, and it did help to soften up the scar tissue on the breast, and it also helped to move the fluid out of the area. So there's different options for that. For those that have head and neck lymphedema, the black garment that you see is called a tribute, and it circles under the neck, and it gives a little bit of compression to the cheek area. That can be used for nighttime. And then you have more of the elastic garments or chin straps that I call that can be worn during the day or around the home. But I will say a lot of my patients that have head and neck lymphedema, they don't like to wear facial gear out in public because number one, they don't want to look like they're about to go in and rob a bank or a convenience store with those types of garments. And it's just very, the face is a delicate area. And when you have facial swelling, you want to not draw attention to that area. So I advise a lot of my head and neck cancer patients, if you don't wear the compression out in public, make sure you're wearing it at home to help soften up that tissue and to make sure you're keeping the swelling under control. There's also nighttime garments, and nighttime garments help to manage swelling, but they're not as tight or as compressive as daytime garments. Daytime garments are meant to be worn when you're up and active and moving around. Nighttime garments, you have less effects of gravity, so you don't need as much compression. So you need a softer or lighter compression. And so you have things called tributes, Jovi packs. They almost look like a little oven mitts. They have chipped up foam in them that help to massage the area, and little lines or channeling to help move the fluid out. You also have Velcro wraps for the leg of the arm that can be worn at night. Velcro wraps can actually be worn during the day too. But for people that can't tolerate the compression bandaging, the Velcro wraps are the next best thing. So a lot of times I recommend these Velcro wraps a lot for patients. It's just easy for them to get on and off, and it's not as cumbersome as the bandages. And for my men that have prostate cancer and that may have swelling in the groin area or the genital area, there are compression shorts with a swell pad that can go into the area to help move fluid out. I've also recommended this for women that have had cervical uterine cancer that may develop swelling into the stomach, groin, and the genital area. So this is very effective. I know some of you are probably wondering, well, if my genital area is swollen, how do you bandage that? There are some techniques for that, but I find that the compression shorts and the swell pad, in addition to the manual lymph drainage, are much more gentle and less what I call invasive way of managing swelling in those areas. So this slide is a picture of someone that had arm lymphedema. So this is the start of treatment. The right arm is swollen. She underwent a course of lymphedema treatment. So the arm is bandaged, and she has a little glove on there just to keep the finger bandages on. And then the third picture is after the course of treatment. You can see the hand is less puffy. There's less indentation at the elbow area because all that swelling has been moved. And then she went into the maintenance phase with the compression arm sleeve and a glove to maintain the results that she received. And this was someone that had breast cancer. This is someone that had lymphedema in both legs. So both legs were bandaged and the toes all the way up to the hip. And then after this patient went through a course of lymphedema therapy, she was transitioned into compression stockings or compression thigh highs, which can be open toe or closed toe. This is a gentleman untreated that had head and neck cancer, and he actually had cancer of the tonsils and underwent like 33 radiation treatments. And most people with head and neck cancer will develop something called submental lymphedema. And I like to call it the turkey gobble. So they get this little pocket of fluid right underneath the chin. And you can see it looks really full. I've had patients come in and say, I feel like I look like a little bullfrog just from all the swelling and that fullness that's there. So after this patient went through MLD and some compression for the head and neck, you can see he has a lot of extra loose skin here because he had so much swelling, and now that swelling has moved out, you can see wrinkles in the skin now. And on the bottom right picture, you can see that the bottom of the chin is not as full. So, I just want to say lymphedema treatment is very effective for head and neck cancer. When you have all that swelling underneath your chin and in your neck area, it can impair your ability to eat and swallow. So it's very important that you get your head and neck lymphedema treated. Moving into lymphedema risk reduction guidelines. So again, as I said, people like myself who have had lymph nodes removed and we're at risk. Again, importantly, we want to take care of our skin and our nails to reduce infection. You want to avoid extreme temperature changes. So for example, I usually say, if you're at risk for developing lymphedema, stay away from hot tubs and saunas because heat can actually open up your blood vessels and allows more fluid to rush into the area. And if your lymphatic system is impaired, your body is not going to be able to accommodate for that rush of fluid in that area, and you're going to swell. So, exposure more than 15 minutes in like hot tubs and saunas is definitely not recommended. And then I have some people say, well, Dr. Champion, you mean to tell me I can't take a hot shower? No, I'm not saying that. You can definitely take a warm shower, but don't, like I said, the hot tubs and the saunas are definitely no-nos at this point. And also being really careful with cold packs or heating pads that are left on for extreme or long periods of time. You want to avoid constriction of the limb that's at risk. So, for my women, say for example, if you had breast surgery on the left side, try not to wear a bra that cuts into your underarm or your shoulders or that cut you too tightly around your middle. Try to wear lighter breast prosthesis if you can, just so you don't have too much stress on the chest wall. You want to wear loose fitting jewelry and clothing, avoid tight elastic bands around the affected area. And then again, try to avoid having your blood pressure taken on the side that has lymphedema or that is at risk with lymphedema. I know with all of my checkups, I have to consciously say, hey, make sure you take it on my right arm. But I also say this, if it's a life or death situation and your limb with lymphedema is the only one they can access at the time to save your life, let the medical professionals do their job and access that arm, because lymphedema can always be treated. So if it's a life or death situation, don't decline that blood draw or that blood pressure being taken on that side. I get a lot of questions about nutrition. There's really no special diet for lymphedema, but however, you don't want to be obese. Like I said, being obesity increases the risk of lymphedema due to the extra body fat that's pressing on those lymphatic vessels. So try to maintain a normal, healthy weight as much as possible. Try not to eat a lot of foods with salt. Salt can cause fluid retention. It can make you swell. Stay hydrated, drink plenty of water. And I have a lot of people ask me, well, if I drink a lot of water, too much water, won't that make me swell? It's actually the opposite. If your body is dehydrated, it wants to hold on to all the water that it possibly can to stay hydrated. So being dehydrated will actually make your lymphedema worse and make you swell. Also, you can try to eat foods that are anti-inflammatory, such as, just fruits and vegetables, limit alcohol consumption, caffeine consumption, and avoid smoking. All of these things can be irritants to the body and cause inflammation, in which your lymph system has to work harder to get rid of any inflammation and infection, and that can increase your symptoms. So I used to tell people, keep a food log and notice or pay attention to what you eat and see if if you eat something or drink something and you notice you have increased swelling, keep a note of what that is. Exercising in lymphedema. I always tell people, especially after undergoing cancer treatment, you don't want to go hardcore back in the gym right after you've had your cancer treatment. You want to do low intensity exercise. You don't want to do heavy weights repetitively, because that can trigger the onset of lymphedema. And I always say, if you've been given a compression garment, make sure you wear that as you're exercising, or at times you're going to be doing heavy activity with the limb that has lymphedema or is at risk for lymphedema. And what I forgot to say earlier about the compression garments, please don't go on Amazon or Google and look up compression garments and say, I think I'm a size medium or a size large, I'm going to order this nice garment. You really need to be measured by a lymphedema therapist or a certified compression garment fitter, because if those garments do not fit you properly, you can actually cause more damage and increase your symptoms of lymphedema. So sometimes compression garments can be really expensive, and a lot of people want to shop around for the best deals online. And that's okay to do if your lymphedema therapist has given you the measurements that you need and they've told you what brand to get, or, if the certified fitter has done the same thing. So please, please, please make sure you are professionally fitted for any type of compression garment that you have. So again, movement and exercise. Like I said, just the big thing is avoiding heavy repeated activity, carrying heavy purses, heavy bags all the time with the affected arm. All of that can increase the symptoms of lymphedema. And air travel, this is a biggie. So for those of us who are at risk for lymphedema or that have lymphedema, you definitely want to make sure you wear a compression garment during air travel, because with air travel, there's decreased air pressure. And because of that, it causes your tissues in the arms and the legs to expand, and that can introduce more swelling into the area. So, also if it's a long flight, you've got inactivity, you're not moving around, so that fluid can accumulate. And, sometimes you're pulling or dragging heavy luggage, that can trigger the onset of lymphedema. So just try, if you're able to, please obtain a compression garment and wear that if you're going to air travel. And I usually recommend wearing it for the entire duration of the flight, and then try to keep it on for 2 to 3 hours after you get to your destination, if possible, just to give those tissues time to readjust to the normal air pressure. Alternative treatments. So there's several alternative treatments for lymphedema. I won't expound on these a whole lot, but a lot of times if you Google lymphedema treatments, or if you're in some of the support groups online, you'll see people that do vibration therapy, vibration boards. And the premise behind this is that it helps to improve circulation and lymph drainage. Acupuncture, some people do that for systemic treatment. However, with acupuncture and the needles that they use, you need clearance from your doctor before getting that. And I definitely recommend not having the acupuncturist stick needles in your limb that has lymphedema or is at risk with lymphedema. So, for those of you who like holistic treatments and you want to try acupuncture, because you may have something else going on in your body, but you're also a cancer survivor, make sure you clear this with your doctor. There's also anti-inflammatory herbs, and I give a huge disclaimer with this, because a lot of times the medications that you may be on for cancer treatment, a lot of these natural herbs and supplements you can't take because it will decrease the effectiveness of your cancer treatment. So if you're going the holistic route, I highly recommend consult with a naturopathic physician or someone who's well-versed in how these different herbs and things can interact with your body. But some of the popular ones that people like is turmeric, ginger. Those are highly anti-inflammatory. Burdock root, red root, mangista. Some of you probably never heard of that. But a lot of these herbs, are good for improving lymph system movement, detoxification, reducing swelling. And again, I say this with an abundance of caution, make sure you consult with a physician before you try any of these. There's different skin healing oils, castor oil, emu oil, coconut oil. A lot of times I recommend patients massage the limb with this, especially if they have that hard fibrotic tissue. It helps to break it up. There's some research that castor oil packs can help in detoxifying the body and the lymph system. And a lot of people do the dry skin brushing. A lot of times you can go to YouTube and you'll see different examples of dry skin brushing. But again, I recommend consulting with a lymphatic therapist before doing it, because if you do dry brushing to help stimulate your lymph system, you want to make sure you're doing those strokes with the brush in a manner that is going to follow the normal flow of the lymph system, so you're not pushing fluid to an area or making an area worse. Elastic taping. I do this frequently with some of my patients who I feel like need a little boost to help with their swelling. So elastic taping, you may know it as kinesio tape, sports tape. A lot of times if you watch like the Olympics, you'll see a lot of the swimmers and athletes, they'll have all this colorful tape. But it's also used not only in injuries, it's also used to help lymphedema. So the purpose of the elastic tape is it's applied in a way that mimics the flow of the lymph system, and it provides a gentle lift on the skin to help increase lymphatic flow. And again, the lymph vessels are underneath the skin. So if we're stretching the skin, we're promoting lymph movement. And the nice thing about the elastic taping is that it can be worn underneath your compression garments or your compression bandages, and it can last 5 to 7 days at a time, meaning you can take a shower with it. Your therapist can teach you how to do it at home if that's something you like to do. And the only warning I have with that is, if you have any allergies to skin adhesives, tapes, and things like that, make sure you let your therapist know, and they can do a skin test on you before applying a lot of tape to your extremity. And lastly, but not least, there are compression pumps out there on the market as well. So compression pumps can be used to kind of simulate the manual lymphatic drainage that the therapist would do in therapy. And these are ideal for patients, like I said, who live in remote areas and you can't readily get to a lymphedema therapist, or a therapist is not available, or, you've had all the lymphedema treatment, but for some reason your body just likes to swell. This is a good solution for managing your swelling at home. And it can also help you to maintain the results you've had from lymphedema treatment. Again, if you Google compression pumps, you'll see some that'll pop up on Amazon for like $80, and they're really cheap. Do not go for those. A lot of those are not specially designed for lymphedema, and they have extremely high pressure settings on them, which can damage your lymphatic system. So I recommend, if you're looking for a compression pump, a lot of times your oncologist or your vascular doctors can recommend those for you. And I know for me, being a lymphedema therapist, if I feel like I have a patient who will benefit from a compression pump, I will recommend that for them and set them up with a product rep who can measure them for the garments that go along with the pump, as well as to let them feel what the pump feels like before committing to it. A lot of times it is covered by insurance, but I use pumps as a supplemental, not as a gold standard all the time, but I find that it's useful for some patients, especially those with head and neck lymphedema. That can be, a little harder to treat. So I found that the head and neck pumps are very effective in treating lymphedema. And this particular brand happens to be Tactile Medical. So, but there are other brands on the market that are effective as well. Lymphedema surgery. There is surgical intervention for lymphedema. Liposuction can help remove a lot of the hardened tissue and fluid for lymphedema. There's techniques called lymphovenous bypass, in which the damaged lymph nodes and lymph vessels are rerouted to your veins so that your veins can take up that extra fluid. And then there's also lymph node transfers, where lymph nodes from the healthy part of your body is transplanted to the area of the body that has the lymphedema, in hopes of restoring the lymphatic function in the area. These surgeries are very specialized by vascular microsurgeons. So, if surgery for lymphedema is something you're interested in, I highly recommend do your research and make sure you find a specialist who is highly skilled in this. And then lastly, I just want to throw a disclaimer about massage therapy versus lymphedema therapy. There are some massage therapists who are certified in lymphedema treatment. However, if you have lymphedema and you say, hey, I still want to get a massage because my back hurts or my neck hurts, that is fine to do. Just make sure that they are not doing deep tissue and the hot rock massages on the areas that have lymphedema. Have them stay away from those areas. I find that it's also helpful to find a massage therapy who's also certified in lymphedema, if possible. Lymphatic or manual lymphatic drainage massage being performed by massage therapists is becoming very popular. So a lot of massage therapists are also specialized in this as well. Doing a lot of deep tissue into an area that's already compromised can make your system or your lymphedema worse. And that concludes the presentation. Here's contact information for me and for Georgia Core. Feel free to screenshot this and refer back to it if you need. And now we'll open up the floor for questions.
Great. Thank you so much, Dr. Champion. We'll keep looking for questions. You can put it in the Q&A or chat, and we'll be able to share it with Dr. Champion. A couple things I would love to say is thank you so much for this. This is really important for cancer survivors to know that there is opportunity or there's treatment for lymphedema. This is definitely a quality of life issue. And a lot of times doctors feel like, well, I've cured your cancer. It's just a swelling of the arm. Don't accept that. Find someone to help you with it. I know when I had my surgery 19 years ago, they took out 14 lymph nodes and I had radiation. So 19 years later, I do not have a manicure, and I still will have a case if I accidentally get cut on my left arm. It will get really infected for something that shouldn't be. So I always have my Neosporin with me. But I think that, as I said, the quality of life is really important because cancer survivors deal with so many emotional issues anyways, and that's just another one added to it. So Katrina, I'm looking to see if we have any questions. So we did have a question earlier. Is any heat or cold packing allowed, or is it just at the time it's applied that's a concern?
It's kind of a catch-22 because I know, like I said, after my breast surgery, I was in a lot of pain and I had swelling and my muscles were really sore, and, me trying to rehabilitate my arm and doing exercises, I had some post-exercise muscle soreness. So I used ice packs with caution. Like I would limit it to like 15 or 20 minutes. When it really becomes a problem is if you fall asleep with a heating pad or ice pack on, or if you're leaving it on for more than 15, 20 minutes at a time, just because your circulation is compromised or your sensation may be compromised. So you really want to be careful with using ice packs or heating pads directly on an area affected with lymphedema. It's okay to use it anywhere else on the body. Like if you have neck pain and you want to use it, that's fine. Knee pain, hip pain, that's all fine. But like I said, use extreme caution when using those modalities for pain. And then also if you're in physical therapy, your physical therapist can also give you some guidance as to that, or maybe recommend some pain relieving creams and gels versus using ice or heat.
Okay, great. And we had a question. Someone said, thank you for the wonderful presentation. Will we have access to the slides? And we're recording this, and so we will have access to this webinar. And I do want to mention you'll get a follow-up email about an evaluation, so we hope you will take that. And I had a question personally. 19 years later, I'm stage 0. I don't have lymphedema. As I mentioned, if I have a cut, it's infected. It takes a while to heal. Is regular deep tissue massage a risk?
I don't think that it's a risk. However, you know, if you choose to do the massages for self-care, if you notice any swelling that develops that has not been there, that's when you want to take the precaution. So I say do self-care, that's very important, but also be very careful. Me personally, I would stay away from like the hot rock massages, you know, in the armpit area or anywhere near the breast. You know, just tell them to be really careful. Um, and I will say this, most people who are going to develop lymphedema, there's research that says that they usually develop it within the first 1 to 2 years of cancer treatment. That's not true in all cases, but just to know that it is a risk, just take precaution and just let your massage therapist know, hey, I'm a cancer survivor, I had this surgery, I had lymph nodes removed, just be careful with this area.
I don't see any more questions. So we want to thank you so much again to everyone that participated. You will get an email with an evaluation. And as Dr. Champion said, we do have resources, georgiacancerinfo.org/survivorship. We have a lot of information there that relates back to these issues. I mentioned we had a survey that talked about 20 to 21% of survivors are needing help with lymphedema. You've got Dr. Champion's contact information, so thank you so much. And what a wonderful story to take your cancer journey and do such a wonderful thing, creating a nonprofit to help other cancer patients. So we applaud you and thank you, and are so proud that you're on our advocacy council. So hopefully, I don't see any more questions. So I guess everyone have a good evening, and you'll get a link with the evaluation and information about the recording so that you can see the great resources that Dr. Champion shared with you.
Thank you so much for the opportunity.
Thank you. Bye.
Bye-bye.